Hi guys, welcome back. We're gonna talk about anemia. Let me tell you, most of the people are from underdeveloped countries and developing countries will be having anemia. It's very common, right? In developing countries or underdeveloped countries, around 45 to 50% around, okay, will be women who are having pregnancy will be having iron deficiency anemia. So it's very common, right? And out of anemia, we are having couple of types of anemia, and out of this anemia, the most common type is iron deficiency anemia. The word itself says because of lack of iron you are having anemia, right? So how do you know that you have anemia? Just to give you a basic idea, why does anemia actually develop? Why will you have anemia? Very important is that you're not eating good amount of food, right? Second thing is that you are eating amount of food, but you are having certain kind of bleeding inside your body. You might not know it. You might be having a gum bleeding, you might be having peptic ulcer that is slowly bleeding, or you might be having a hemorrhoids. You do not you're not having an idea about that. Or if you're a female, you're having a lot of period menstrual cycle, the bleeding phase is longer and you're having heavy amount of bleeding, right? So these things will tell that you're having anemia, right? And also some kind of intestinal worms, right? And also your if you are taking certain kind of medications, right? It's some one medication is also methotrexate, so that can also cause you anemia. So the most common is iron deficiency anemia. The how do you find out that you're having anemia in the first place, right? Very important. First thing you have to remember is that you have to stand in front of the natural daylight, just like I'm standing, right? I'm just standing in front of the sunlight, right? You have to stand in front of the sunlight, not your natural LED light or CFL or incandescent light or tube light. No, natural sunlight. Once you do that, you go near, obviously you stand in front of mirror and just pull down your lower eyelid and just see for the lower eyelid margin, right? Is it pink or not? It should be pink in color, right? It is known as lower palpebral conjunctiva. It should be pink in color, right? It should not be pale. What is pale? It's like whitish blanched area, right? So it should be pink in color. Second place you can very easily check is the tip of your tongue. It should be pink in color. The third place is your hand, right? Is your hand. All this area, like obviously it's difficult. Okay, I'll press it and just try to get an idea how does it look like. Can you see there this pink part? I'm just exaggerating it. It should be pink in this manner, right? It should be pink in this manner. Okay, in video it won't be so appreciable, right? It should be pink in color. Your soles and your palms should be pink in color. And very important is your nail bed. It's very important, right? If you go and see your nail bed, it's like pink in color, right? If I press it, it becomes white. Once I release it, you can see this color, right? Okay, it should be pink in color. So these are the places that you want to check. But very important is this lower eyelid, daylight, right? Daylight. It should be natural light. It should not be artificial light. You will be getting a wrong impression. If you think that you are having all this, go and get it checked by a doctor. It's very easy, and treatment is very easy, very simple, very cheap. And let me tell you, you might be having anemia. You might be thinking that you don't have anemia. If you're having anemia, what are the cause? One of the very important cause of anemia is certain kind of kidney issues, right? If you are having anemia, then you should always think of that you might be having some problem in your kidneys, right? Because your RBCs are produced by the kidneys. If your kidneys are not working perfectly fine, you will be having anemia. People who are having end stage renal disease, or like people who are having pathology in the kidney, right, or gross disease in kidney, they will be definitely be having anemia, right? So this is very important. Also, if you're having anemia, you'll be just tired, you'll be just tired. You'll be like not able to do exercise. You cannot do any kind of exercise. Your breathing rate increases very shortly, and you're having shortness of breath. You have to catch up your breath. You're tired, you're sleepy, you're drowsy. These are all the symptoms of anemia, right? So get it checked. And okay, so once you go and get your blood checked, what is the cutoff? For males it is 13 mgdl. If it is less than 13 mgdl, you are having anemia. If you are a female, if it is less than 12 mgdl, you are having anemia. So females cutoff is 12 mg, males the cutoff is 13 mgdl. Now why 1 unit is less in females? Because females are having menstrual cycle, so they are definitely going to bleed out around 2 days to 7 days, right? They can bleed up to 80 ml. So you should not go more than 80 ml, right? 80 ml is the upper limit of normal bleeding, right? And the cycle can be from 21 days to 35 days, but average is around 28 days. So in every 28 days you'll be having a bleeding cycle for around 2 to 7 days. Around 4-5 days is average, right? So you are having bleeding, so you're losing blood there, so you will be having anemia. Chances are more, right? So this was a short video about this thing about anemia. If you feel the symptoms, and even if you don't have the symptoms, just check it out yourself. Very easy to do it. Once you think that it doesn't look like to your partner or to anyone, just compare it with your friends, your family members. If it doesn't look like that, you are having a bit more red or a bit less red, right? It looks like not doesn't look like very pink. Go and get it checked by a doctor. It's very easy to do it, and treatment is also very easy, right? So do not avoid anemia. It's common, it's very common that you will be having anemia. It's very common there, right? So that's all for now, and thanks.